Public health does have core functions, and I'm sorry, core disciplines. And so when we think about the core disciplines of public health, we have epidemiology, the science of public health. We have, or actually, it's the main science of public health, but really they're focused on the trends of diseases and understanding disease patterns. We also have biostatistics, and biostatistics is utilizing data to really drive public health decisions. And we have social and behavioral sciences, which really tries to understand why people act the way they do and tries to influences people's behaviors to help them develop lifestyle changes, right? So that they could improve their health through lifestyle changes, aka behavioral changes. Then environmental health sciences really focuses on protecting people from environmental hazards. This isn't just simply like the natural environment, like air, like the air quality, water quality, etc. This also focuses on the built environment, things that are man-made or person-made, that are created, like the structures of our sidewalks, the building infrastructure, etc. And also we have health policy and management, which focuses on improving healthcare systems and also the public health infrastructure. And then we have biomedical science, and this is really where public health and medicine intersect because both fields rely on biomedical science. We need to understand pathogens, behaviors, etc., in order to create solutions like vaccines, in order to cure people and also to prevent people from developing diseases. So when we look at epidemiology and we want to define it, it's the study of disease patterns, cause and effects in populations. Really, they help identify risk factors and preventative factors because they do what is called contact tracing. And they ask people, hey, how do you get this disease? So they begin to identify, like, oh, both these people were drinking this water, so possibly the disease was caused from drinking water. But the people who were not drinking water, those are the ones who were able to stay safe, or they were drinking water over here instead of over there. So that would be a preventive measure, right? So risk factors are things that are pulling people or causing people to develop a disease, and preventive measures or factors are things that allow people to stay healthy and to decrease the risk of developing a disease. Certain terminology we have to understand is prevalence. Prevalence is the total number of cases in the population. So how many people are sick, how many people are impacted by something. That's the prevalence rate. Incidence rates is new cases. And so new cases is simply like if you did a test today, right? You did a survey today and you found out that X amount of people have depression. Okay, you found out that 5 people have depression, and then tomorrow you do another test and you find out that 5 people, 5 more people have depression. So now the incidence rate is 5, but the prevalence rates would be 10 because you got to add yesterday and today. So 10 would be the prevalence rate, but incidence rate only accounts for the new people. So that would be the 5 new people that you tested today, and doesn't include the 5 people that you found out yesterday had depression. Life expectancy is the average number of years a person is expected to live. Life expectancy constantly is going up. It has potential to go down. Like with COVID-19, we saw like a 1 year drop in life expectancy, and life expectancy tends to go down as a population whenever we have wars or pandemics. We also have infant mortality rate, and this is the infant death per 1,000 live births. Some examples of epidemiology in action are when they track the COVID-19 infection rates, also conducting cancer clusters to identify how certain people are developing cancer. For example, there's a story about how some people were living next door, or this community was living next to a paper waste management plant, and they discovered, like in adulthood, a lot of those people eventually developed colon cancer. So the epidemiologist was like, well, why are all from the same community developing colon cancer? And what they found out, that paper has a certain chemical in it that is cancerous to people. So those children grew up alongside those paper plants and they end up developing cancer later in life. But it was the epidemiologists who had to trace it back to understand exactly what was going on. They also study the effectiveness of vaccines as well in preventing diseases. So, okay, all these people are vaccinated. Did it work? Right. And so that's part of their job to really understand that. So when we think about the CHW role in epidemiology, they assist in data collection for community health assessments. They educate the public on disease prevention and early symptoms. They also participate in contact tracing. So that means like when someone gets sick, right, they need to figure out who are all the other people the person might have came in contact with, who also who spread out the disease, right? So they assist in outbreak response efforts as well. When we talk about biostatistics is epidemiology go out and collect the data, and the biostatisticians are the ones who actually analyze the data. And so when we think about the definition about statistics, it's the application of statistical methods to analyze public health data. And really what it does is it helps public health officials to make evidence-based decisions because in public health or in science, we can never say something truly caused something, like unless something happened and then boom, then something else happens. That's a cause and effect. But most of the time, what we find is association or probability, right? For example, when we talk about lung cancer, we can't say that we can't say that tobacco smoking causes lung cancer, because if that was the case and every time someone smoked, we would be able to quantify and say, if you smoke 1,000 times, then you're gonna get lung cancer. And we're not able to quite say that because there's more variables that go into it. Because you have some people who smoke their entire lives and never get lung cancer. But what smoking does do, it increases the risk of of getting lung cancer. So it increases the association. There's a high association between people who smoke tobacco and develop lung cancer. So we say there's a strong association, there's strong risk, there's a big probability of someone developing lung cancer if they smoke tobacco versus when someone doesn't smoke tobacco. So it's association or probability, but we can't say for sure that smoking cigarettes will lead to lung cancer. We can say that there's a strong association. So biostatisticians try to find the probability or the strength of association between one thing and another. And so when we think about the examples of biostatistics, they analyze trends in chronic diseases such as diabetes and heart disease. They assist in the fact they assess the effectiveness of public health programs like smoke cessation efforts. They also estimate the vaccine coverage rate and their impact on community health. And when you think about CHW's role in biostatistics, they assist in survey distribution and health data collection, because biostatisticians need data in order to do the statistical analysis. So the CHW might be the one who goes out in the community and who actually goes to the community and say, take this survey. They also help analyze community health trends and identify disparities. Remember, disparities are preventable differences. So CHWs are front line. They're the ones who are in the community. So they're the ones who are able to ask questions, right? And figure out like these people are lacking this. But we know if they had this, then they would be able to prosper. So the lack of is that disparity is a preventable difference between pretty much the haves and have-nots. And then so will you practice equity by providing resources based on need, and that's how we decrease disparity. They also share findings with community members to promote data-driven health behaviors, meaning that once they find out that there's an association with something, they're the ones who are probably the ones who go back and report out to community members, say, hey, the research shows that doing this behavior increases association with this, and it shows that if you do this behavior, you can reduce this issue that you're going through. And then social and behavioral sciences, it studies how social, cultural, and behavioral factors impact health. So it really focuses on health behavioral change, mental health, and health disparities. So really looking at why do people behave the way they do, right? Even though people know that there's all these negative outcomes for something, they still behave a certain way. For example, people know that tobacco smoking is bad for them, yet they still smoke tobacco. So, what can we do in order to get people to understand that smoking tobacco is problematic? That's the social behavioral people. That's where they come in to try to help people to create behavioral changes. Also, looking how society impacts people's behaviors as well. So some examples of that is designing anti-smoking campaigns to reduce tobacco smoking, implementing mental health interventions to underserved populations, also studying the impact of social determinants of health, those factors that influence health and on health outcomes, etc. So when you look at the CHW role in social and behavioral sciences, they have actually a really big role because the whole purpose of working with someone one-on-one or working with a community is we want to shift their behavior. We want to make sure that they're able to shift their behavior and create new lifestyle changes. The one thing that we have control over as individuals is our behavior. So even if our social environment is not the best, we have control over our behavior. So CHW, by working one-on-one or being the frontline public health professional with a lot of these communities, they have the ability to educate people on ways to shift and change their behavior. So they can educate the communities on healthy behaviors and lifestyle choices. They can also provide mental health support and referral to counseling services, and they also could address they can address barriers to healthcare access, such as language or course cultural differences. So that's the social aspect of it. Then we have environmental health sciences. And so environmental health really examines how environmental factors like air, water, food, population, and housing. So we see the natural environmental factors, but we also focus on the built environment as well, which are things that are human made, such as building construction, sidewalks, do we have parks, etc. These things that we create when we create society, and all those things impact our health. So the environmental sciences, health sciences aim to reduce exposure to environmental hazards and promote safe environments. Some of the things that they may do are investigate lead contamination in water, address air pollutions, impacts on asthma, and also monitoring occupational health risks in workplace. And we think about the CHW, once again, are the educators of the environmental health sciences. So they're educating communities on air quality, on water quality, sanitation, and food safety. For example, if there's in a community that potentially has contaminated water, they may say, boil your water before you drink it. For food safety, some people may think it's okay to leave leftovers like rice out and then eat it the next day. And then they get sick, they don't know why. So CHW might be the one who needs to educate the people on food safety and also, preparing food correctly and making sure that it's healthy, right? And then also advocate clean environments and safe housing conditions, and also help identify environmental health concerns affecting local communities. Like some people don't know that if their house was built like before the 1960s, that it potentially could have lead in it, right? Or asbestos. And so the CHWs might be the one to go into these communities that do have these older houses and to share out these concerns and these issues. We also have health policy and management. So this really focuses on healthcare organization, policies, and financing, and it aims to improve healthcare access, quality, and affordability. Health policy management is actually what my master's is in. I have a master's in public health with a focus of health policy and management. And so really it's looking at how do we utilize the policies to shift the culture of healthcare systems. And so some of the examples are expanding Medicaid programs to cover more low-income individuals, implementing public health laws, designing emergency and preparedness plans for natural disasters. And when we think about the CHW role, really CHW, when it comes to the healthcare system and organizations, et cetera, is really being able to help individuals to navigate the healthcare system, as well as for them to understand how to access it. And to access it, meaning insurance programs, right? Because you need money in order to access the healthcare systems. We also look at CHWs to advocate for policy changes that improve community health. They're the ones who are working with the communities. They are the ones who know what challenges that the community health workers might be running into. I'm sorry, that the community might be running into. So they are the best ones to advocate for a problem or to bring a problem to the attention. They're also the ones who provide input on local health policies and resource allocations. Biomedical science, like I said, biomedical science is the one that straddles both um, medicine, right? Because it's important for both fields. And so when we think about it, biomedical sciences they apply biological and medical knowledge to public health challenges. They focus on disease mechanisms, right? Really understanding how does a disease cause, get created, etc., impact humans, all those things. So disease mechanisms, vaccines, drug development, and also medical innovations. And so the biomedical science are the ones who are developing the vaccines. They're the ones who are doing genetic research. They're also the ones studying antibiotic resistance. And when you think about CHW role, they're the ones who are educating the community about the knowledge that the biomedical science people found out, i.e., like vaccines, how important it is to get vaccinated, how important it is to adhere to medication, right? The biomedical sciences were the ones who recognized and learned and discovered that vaccines work. If you need to take the medication 2-3 times a day in order for it to be to work, if you're on antibiotics, you can't be drinking alcohol, etc. It's the biomedical science people who were discovered those things. So CHWs are the ones who relay the message and educate the people on that science that was discovered. They also promote scientific literacy by dispelling myths about vaccines and treatment. There's a lot of misinformation that is passed about the effectiveness or the potential harm that something can do. And so they're the ones who really go and demystify this information for people.